forward.
My screen look good?
Yeah, it looks wonderful. Thank you, Aster.
Okay.
Welcome, everybody. Thank you so much for joining us. We are going to go ahead and get started. I'm going to introduce Pre-Health Shadowing a little bit. We are a student-based, student-led, woman-led nonprofit organization focused on creating shadowing opportunities for pre-health students during the COVID-19 pandemic. My name is Nina, and I'm the co-founder and CEO of Pre-Health Shadowing, and I'm really excited to present to you guys another virtual shadowing session today.
So I can go?
Oh, sorry, we have a couple of slides. So if anybody is looking for a mentor, we are actually going to start off today with a mentorship raffle. We are holding a mentorship networking event on February 19 to 21. So this is coming very soon. This is your chance to earn a potential virtual mentor for life. If you guys are interested, you can join in this raffle. We will be having one every single day of our live sessions. Submit your raffle tickets at the beginning of the virtual shadowing session, and we will announce the winners at the very end of the virtual shadowing session. So you can enter by two ways. The first way is PayPal on the left. The second way is Venmo on the right. Each raffle ticket is $3, and winners will be announced at the end of the session. Our handle is @PreHealthShadowing, and it's also in the chat if you guys would like to see. Alrighty, go ahead. We do have closed captioning to accommodate students of all abilities and needs. If you guys have any ideas about how we can be more accessible, feel free to email us at info@prehealthshadowing.com. Since pre-health shadowing is all online, we have the ability to connect with students not only all over the US, but all over the world. Go ahead and drop in the chat where you guys are Zooming from today. We'd love to know. Wonderful, thanks for joining us. You can go ahead. If you guys want to stay in the loop, we actually are holding a virtual shadowing session every single weekday until June. So if you guys want to get your virtual shadowing sessions in, follow us on Instagram, follow us on TikTok. We have some wonderful content for you all. You can also get on our email list. We send one email a week with all of the professionals for that week, where you can get all of the Zoom codes, the registration links, everything. If you guys are interested, go on the website that was just dropped in the chat and put in your email. Alrighty. With pre-health shadowing, it has its perks. So we do have some partnerships that give you guys some wonderful opportunities. We have partnered with Kaplan. All you have to do is respond to a short survey. It takes less than 5 minutes, totally anonymous, and you can get 10% off of any Kaplan course. Not only that, but you'll also get free study guides to study for any of those standardized tests that you're going to have to take for your next step into the next schooling that you're looking to go to. This is a wonderful opportunity from student to student. These study guides are awesome. I'm taking OChem right now, and it has literally everything. Flip over to the Fem Health Summit, another one of our partners. This is a woman-led organization, and they are actually offering a year-long dive into the journey of 19 successful CEOs, founders, leaders in healthcare for an entire year. So if you guys are interested in reserving your spot, check this out. We do have, normally it's about $49. With pre-health shadowing, you can get it for $29, but only for a limited time. So if you're interested, act now. This is a year-long event to just get amazing insight, and I cannot stress this enough. Like, if you guys can, please take advantage of this opportunity. If you guys aren't feeling the $29, next slide, please. We do have a giveaway. We are giving away 15 scholarships to the Fem Health Summit, which is a year-long membership to gain insight from successful CEOs, founders, and business owners. One woman has a multi-million-dollar business and actually was on Shark Tank and sealed a deal with Mark Cuban, so which is really cool. We do have a scholarship opportunity for you all. So there's two ways that you can enter. You can either submit a piece of writing or a video. The piece of writing has to be 350 words or less. The video has to be 2 minutes or less. You will be answering the same 3 questions. What are you passionate about? Why do you want to attend? And how will Fem Health help you? These will be due on February 18th. If you guys are interested, go ahead and check out our social media for more information. Next slide, please. We have also partnered with the woman-led organization Mask for Mask, which donates 4 masks for every 4 masks sold. This is to help those who do not have the resources during this ongoing global pandemic. Masks may be donated to a hospital lacking in those resources, people in the homeless community, or really just anybody who doesn't have what they need to provide for themselves in terms of protection. If you guys use the code PHS15, you will actually get 15% off of your purchase, and 10% of proceeds will go to pre-health shadowing to help keep pre-health shadowing free for students everywhere. They have a bunch of really cute designs. You guys can get it for yourself or your friends. All right, if you guys are interested in being a part of pre-health shadowing, we are a student-led organization. You can join us by being a student volunteer or a team member. Thank you. You can be a team member. We also have a high school program, which students can get involved with and create pre-health shadowing as a club across various campuses all over the United States. So if you guys are interested in this, sign up to be in our student team, prehealthshadowing.com/medical shadowing/volunteer. If you guys are able to, we do ask you to humbly please donate. We are a free nonprofit organization, student-led. We are running solely off of the donation and time of our volunteers. Please help us out. If you guys could donate $1, $5, $10, whatever you can, that will really help us keep our website up. We have been having repeatedly experiencing website crashes where students will be in the middle of taking their post-shadowing assessment after they've joined a virtual shadowing session to get their certificate that verifies their virtual shadowing hours. And the website has crashed midway, they failed the test, and now they cannot get their shadowing certificate. So if you guys could please help us out, you guys are creating opportunities for students who may not have had that opportunity. If you are financially unable to donate at that time, we completely understand, we're all students. If you could just please send this to someone who you feel could donate and support our program, we would much appreciate that. Thank you so much. Feel free to type your questions in the chat, and members of our student team will be asking them during the Q&A portion of today's session. I encourage you all to take good notes because there will be a post-shadowing assessment available to take to earn a digital certificate that verifies your virtual shadowing hours for today's virtual shadowing session. If you can, please turn your cameras on. This makes it as close to a shadowing experience as we can. And it's always fun to talk to faces instead of squares. Alrighty, without further ado, I would like to present to you our professional for today. Thank you so much for joining us, Dr. Anna Silva. It's a pleasure to have you.
Hi, guys. Thank you for having me.
Wonderful. You want to go ahead and share your presentation? We're going to go ahead and release the very first polling question for our students. What specialty do you guys think you guys are going to go into? This is multiple choice, so pick as many as you're interested in.
Hold on. Where did my thing go?
Awesome. If you haven't yet submitted your response, go ahead and do so very quickly. I'll be ending the poll in just a couple seconds. Alrighty, and I'm going to go ahead and end this poll, and I'll share the results so everybody can kind of take a look around the room. The Zoom room.
Oh, you guys fail. I'm an endocrinologist. It should be 99% endo. Just kidding. So that's pretty typical of what we tend to see is a lot of people are aiming towards the surgical side, but I hope to change your minds. I am an endocrinologist, and doing this, it reminds me of what it was like to be an undergrad and feeling lost and overwhelmed, and like you have to be doing everything perfect in order to actually, get to to the end goal, which is to be a physician. But I promise you that there is no one path to becoming a doctor. And there are many, many different ways to get there. And I hope that I can kind of show you that through here. My goal today is to kind of show you where I made mistakes so that you all can learn from what I did wrong, and that you guys can be more successful and get into medical school like I did, but in a less painful fashion. All right, so endocrinology and you. Who am I? I am not your classic physician. I've always liked to think outside of the box because I don't like to follow rules very well. So this was a great way for me. I actually decided to become a physician when I was in my biology class, because I came up with this idea that I would never have to be sitting in an office and having someone tell me what to do. Guess I was wrong about that, but there we go. All right. I was born in Brazil, and coming into the United States, I saw a lot of different things. My parents had very little income when we came here. We lived in an efficiency. My husband likes to joke that I did sleep in the closet for the first year because I chose to have privacy from my siblings. So I got to see a lot, and my parents started from nothing and build multiple different businesses, and they were very successful. So that was something inspiring for me as well, to build something of my own. I also never could understand what my undergraduate path was going to be. So I bounced around from multiple different universities because I really thought that there would be one perfect fit. And the reality is you can make any school be what you need it to be. So outside the box thinker, that is I, and I'd like to share that with you guys because it'll be good for your future. So my undergrad journey, when I was in high school, we were actually able to dual enroll in college. So I started my community college experience my senior year. I did half of my day was at the high school and the other half was at the community college. And I loved that because I got to understand how different high school is from college. And I started my undergrad career with 5 credits short of finishing my first year. And then I went to the Florida Atlantic University for my first semester as a biology major. But my brother, who was at another university, told me I would never get into medical school coming from FAU and that I must switch to a different school. So of course I listened to him. And then I transitioned back to my community college that I loved for 1 semester so that I can get my AA. And then I went to the University of Florida, and my major was microbiology and molecular science. They did not have a formal pre-med program at that time. So what I did wrong in undergrad, there's a lot I did wrong in undergrad. Please don't do this. I listened to people that had never applied nor gotten into medical school for advice. So first place I went wrong was I was at FAU doing a major that I actually really liked. And I was close to home where I felt comfortable, and I had a full ride plus money to go for book expenses. But my brother, who had no business giving me advice, told me that I had to switch school. So I did that wrong. And then I picked a major that was probably not the best major. Microbiomolecular science is a great major for someone who is wanting to go into the realm of some kind of research or becoming a scientist. It does not allow for very much time to study because it is a very intensive program. So when I would do my electives, which were classes that would make me look good for an application for medical school, I was overwhelmed with work from my undergrad. Like one of my electives for my undergrad that was required was advanced medical virology, which sounds great for medical school, but it had nothing to do with what you would do in medical school. It was sequencing viruses so that you'd understand how they come up with vaccines and how you genetically alter things. So my counterpart was doing some fun class and I was in that class, which made it very difficult to study. So in my humble opinion, pick a major that will allow you to have a cushion, because you will need cushion to study. So what did I do right? I got good grades. Even though I was very overwhelmed with my course load, I busted my butt and I got good grades. And I volunteered often and all the time because I love to. I wanted to give back to the community, and I wanted to feel good about what I was doing in the world. And it was something that I found meaningful. Um, in high school, I used to volunteer at a nursing home with Alzheimer's patients, and I loved playing games with them, giving them an outlet for something fun. And then in undergrad, I volunteered at the hospital as a cuddler. So I literally got to hang out in the NICU with newborns, and I got to hold them because it's important for them to have physical contact for them to develop properly. So it was probably one of my fondest experiences. I did get to see what it was like to be in the medical field, and that was great. But I also got to do something that I really loved. So I really encourage you guys, as soon as this pandemic is done and over with, to find something that you really care about so that you can go out and do that, because it will grow you as a person. And don't forget, you have to write a lovely personal statement. And there's nothing nicer in a personal statement than something that is. What else did I do? I shadowed docs. Why? Because I wanted to see what's it really like to be a doctor, right? Because we have this perspective that the media shows us, or what in our great minds we believe it is to be a doctor. But I had no close friends or family members or anybody that I knew that was actually a physician. So I had no clue what that meant. So I would literally pick up the phone and shadowed my primary care doctor, looked people up on the internet, called and said, hey, I want to be a doctor. Can I come and shadow you? Oftentimes you get a, yeah, we don't have time for that, hang up in your face, but you'll get some people that say, sure. And now you guys have this, which is really cool. I did not have this back then. So what I wish I had done differently, AKA, this is the advice piece, major. That was a huge, huge, huge thing. Not to be a Debbie Downer, but there are a lot of things that can change in your guys' lives from today until the day that you become a professional. You guys are really young. What if you get to medical school and you absolutely hate it, right? You're like, oh God, this is not what I had signed up for. Your major is going to decide what you do for the rest of your life at that point, right? So think about that. Pick something that you actually may enjoy doing. And it doesn't matter. It's not going to make a difference to get into medical school. One of my best friends in medical school was a music major. How nice is that? So he used to play at an orchestra, and we used to go and watch him. And that also, when the admissions people are looking at your applications, unfortunately, that person that's reviewing your application has a checklist, and they have, did they complete XYZ required courses? Sure, they did. What was their GPA for those courses? Great, they meet the cutoff. What was this person's overall GPA? Great. What was their SAT score? Maybe they don't ask anymore, but what were their standardized test scores? Sure. What does that personal statement look like, right? And if that person is bored to tears because it's the 60th statement they've read that day and it all starts the same, you may go into the pile that never really gets reviewed by that review committee. That's just how it is. So once again, my major, which was very course intensive and unfortunately did not house all my prerequisites, made it very, very, very time consuming for me to be able to keep my GPA up and do all my classes that I had to do, which also led to me having very little fun time in my college time, which honestly sucks, because when you're in medical school, you're going to have very little time. It's a lot of work, medical school. And then when you're a resident, you're working a lot. You're a resident for a reason. You reside at that hospital, right? So this is the prime of your lives. Make fun of it. You should enjoy it. Friends and family time. I really do miss that. And most importantly, I really wish I had had a mentor, someone that had actually taken the path, and I put it in quotes because there is no path, someone that had become a physician, so I can bounce off ideas with them and say, hey, what would you do in my situation? What else would you recommend that I do? And then the other thing is really try to, if you can, spend time in the field that you think you want to go to. And that's why I asked that question. A lot of people go into medicine thinking that they want to be a surgeon. But if you were to spend a day or a week in the life of a surgeon, would you really want that lifestyle? Do you really want to be at the hospital at 6 a.m. for your 7 a.m. cases? Do you want to be at the hospital for 12 hours a day because your case got bumped and you're going to be there until 9, 10 p.m.? Do you want to be on call, which means leaving your house in the middle of the night on a weekend or a holiday or your child's birthday to go in to do a case? It may not be that, right? So it's important to be in the field, but not to look at the glamour side of it, to really look at what does that life look like? And is this what I want for me? Take it from me. I really thought I wanted to be a radiologist because I loved radiology. I thought it was the coolest dang thing in the world. You had to know about everything. And I was doing rotations in different places that I was actually scheduled to do my interview to match for residency. No joke. I fell asleep standing behind my attending in the middle of chest x-ray rounds. And thankfully, this person that was next to me caught me so I didn't face plant on my attending. And I was like, what in the hell am I doing? What is this going to be the rest of my life? I'm bored to tears, but the pay is awesome and there's great job security and sure, I'll know everything. And it was the day before I had to submit my ranking for my match list. So I, at that moment, decided, all right, I need to think of something else because it's a 4 to 5 year training beyond this and I'm falling asleep. Is this for me? So I wish I had spent more time in radiology before I had decided that that's what I had thought I wanted to do. So then I thought back to all my experiences and I really loved primary care. They got to know their patients, they got to touch patients, they got to make a change. And that's what I ranked, switched on the last minute. And don't forget to ask the right questions. Ask questions that are relevant to where you are today in your journey. The journey is super long and each phase has its rhyme and reason. So think ahead for the future, but think about right now, what is my goal and what do I need to do today so that I'm ready for the next stage, right? So doing really well in undergrad so that I'm prepared for my future, whether that means I become a physician or not, and preparing me to get into medical school so I look really good and I can get into whatever school I want to. So volunteering, once again, I'm really big on volunteering. I think when the admissions guys are looking at this, remember, everybody is being put into categories, right? This one meets all those things. But part of being a physician is wanting to be involved with the community, right? That's what doctors do. We heal others and we get involved and we take care of people. So volunteering will, in my opinion, make you a better person and you'll start being exposed to what you'll be exposed in the future, which is disease and healing and understanding how you're impacting your community. But will also make it so that those guys, when they see your application, they say, you know what? This is a cool person. Maybe they don't have exactly the highest grades in the world, but they're meeting our cutoff. But this person really cares and they really are out there and they're involved in something that they care about. So I listed again, memory care facility. That was awesome. And it taught me a skill because my mother-in-law has Alzheimer's. I never imagined that that would be true in my life. But from the 4 years that I spent volunteering there, I really understand how to handle her now, which is great. And it's a benefit to my entire family. And actually in high school, I thought I wanted to be a neonatologist. So volunteering as a cuddler, I got to see neonatologists. And to be honest, I couldn't stomach them doing procedures on infants. It made me feel kind of, ugh, this isn't for me. So I'm glad I did that, because I still wanted to be a doctor, but maybe not dealing with infants. Okay, so where can you volunteer, right? Because I'm telling you guys, it's really important. Anywhere pre-COVID, and hopefully COVID goes away soon. Libraries are great places. Why? They have elder activities and activities for the youngsters. It's a great place to do that. Nursing homes, assisted living facilities, those guys really need interaction with people. They really need something fun and enjoyment, and you may learn something from them being there. Hospitals, each hospital has a volunteering department, and they have, I mean, you can't imagine the different jobs they have listed there. You can work at a radiology department, you can work in the lab, you can work in the peds department, you can work in the NICU, you can work in the ER. And it's great. Why? Because you're in the hospital and you're getting to meet people and you're getting to see what that really looks like. Homeless shelters, they're constantly in need of people helping them out. And when in doubt, be creative. Come up with your own place that you'd like to be. And then the question is, how do I shadow pre and hopefully post-COVID? Shadowing is really, really important, like I said, because you'll get to see what it really is like to be a doctor and to see what kind of doctor you want to be. Pick a field that you think you like, right? And I honestly think maybe starting with primary care, because they're broad and they kind of do a little bit of everything. Some primary cares do minor procedures in their own office. They do dermatology in their own office. I actually rotated with one that had her own infusion center in her office. So it's kind of crazy. They do everything. And go to Google, right? Type in whatever specialty, pull up that doctor's phone number and say, hey, I really would love to become a physician. Does Dr. whatever allow students to shadow? If you take nothing from this, take the last sentence, the next sentence I'm going to say, and follow it to a T. Be friendly and polite to everyone and anyone in that doctor's office. And most importantly, that person at the front desk, because they are the face for that practice and they can make or break you. If that person doesn't like how you came across on the phone, they will not grant you your greatest wish, which is to be with that physician. But if you come across super friendly and in need and they connect with you, they may go out of their way to try to get that doctor to let you into that office. I promise you, because I saw it. Call your own doctors, right? You all have your own physicians, or you have family physicians. Call them and say, hey, I really would love to do what you do. Can I spend a day with you and just get an idea of what this is like? And then if you're lucky enough, you have a family member or a friend of a family member that is a physician, and you can ask them to shadow, or what we're doing here. And then the other thing is what to get out of shadowing, right? So you're working on shadowing. You're not going to learn medicine. That's not your stage right now. Your stage right now is not to understand how to diagnose somebody, understand how to take a history, understand how to prescribe medications. That's way beyond what you're supposed to be doing. But it's learning what is medicine, right? What's it like to be a doctor? What's the role of a doctor? What do they do all day long? Is this what I want to do for the rest of my life? Does this person seem happy, right? Or not? Would I like to be doing what they are doing right now? Or can I not picture myself doing that? And most importantly, what is their work-life balance? Because remember, in the future, you may choose to have a spouse and you may choose to have children. So you may want to consider what that would look like for you in the future too. And then this is important. Man, I've seen some crazy things when people shadow. So hopefully when Corona's over and you guys are out there in the real world, be a curious and polite fly on the wall, right? So you want to be inquisitive and you want to learn and understand, but don't be disruptive, because that's not good, right? Everybody there, you'll see it. It's like everyone has a task and everybody's on trying to keep to a certain time. And if you're there disrupting that, that person is going to ask you kind of to leave, and they will not be willing to write you a good letter. Treat everyone in that office with respect and pretend that they were writing your letter, right? In the exam rooms, please do not volunteer to talk to the patient. Be friendly and smile. You don't want to be awkward, but don't go in there and start chatting up with the patient. They're not going to be happy about that. And then read the basics on the field before you go in, right? Like, what's a primary care doctor do? What general treatments do they have? Learn about that practice. Do they do something completely different, so that you can be inquisitive when you're there in an appropriate fashion. Don't ask too many questions, but do not seem uninterested. And that's a hard balance, I think, for a lot of students. You want to seem like you're there and you're trying to learn, but you also don't want to be someone that's asking so many questions that you're taking away from that time of that office, right? Put the phone down. We're so used to having our phones. Put your phone down. Do not take your phone out during your time there. It's very noticeable. It's very disrespectful, and people will not like that. That is not the vibe you want to give. Put your phone on do not disturb, right? Imagine you're standing there, fly on the wall, and your phone ring, and now you're fumbling to get it. What do you think that doctor's going to think? Okay, this person clearly doesn't care that they're here today, right? So then find a mentor. I really and truly wish I had one, and I never did. You can get a mentor from your shadowing experience, right? You're an awesome person at shadowing. They love you because you ask great questions. You seem super inquisitive, and then you're just honest with them. Hey, I really want to do this. Is it okay if I email you every now and again if I have questions and I need some guidance? Most docs would honestly say, sure, why not? We're here to help you guys. Social media, just like you guys found me, you can find other doctors that say, I would love to be in your field. Can I learn more from you? Some schools have listings of mentorships. Some do not. There are societies that you can look into. And when in doubt, cold call. Google and reach out. Oops. Interviewing. That was going to be my, I don't know how to go back to that one, but interviewing techniques. So you did all the work and you got your interview, right? Now what? So first, get the interview. Most universities have a career resource center, and thinking about medicine, you think to yourself, oh, you know what? That doesn't apply to me, but it really does. Why? They have, they're experts at creating a resume. So guess what? Have them look over your application and help them even look at your letter that you're writing, and they can help you restructure that. I did that. I took a course at UF for career development, and I had them look at all my stuff before I submitted it to my applications. And most importantly, they will train you on how to have an effective interview process. Super cool. You'll get to practice interviewing with people that train people how to interview, because medical school interviews can be very stressful, okay? You may walk into a room with 5 or 6 different people sitting at a desk, staring at you, bombarding you with questions. If you've never done that before, you're going to be uncomfortable as hell, and you're going to struggle to be as good as you could be, right? Because, whoa, hold on, I wasn't expecting that. UF's interview was actually a stress-based interview, which is the weirdest thing ever. But they bring you into a room with 5, 6 people to interview you, and they ask you to do something that they know you cannot do, just for fun, to see how do you respond to being under stress. Oh, the AC is broken. Can you open that window, please? By the by, the window doesn't open. So that's where becoming well-versed in interviewing is great, because you've done it so many times that you're okay, and you won't be nervous and stressed out and be able to do it, right? So why did I choose medicine? I love to think critically. My advanced biology class sold me into the idea of medicine. I loved learning how the body worked and how everything did what it was supposed to do. I wanted to be challenged. I didn't want to be bored. And like I told you, I did not want to be sitting in an office with a boss. So I thought medicine had it all. And then why did I choose endocrinology? After I decided that I did not want to fall asleep in my job every day, all day, I decided to do internal medicine, because the hospital was a great way to not be stuck in an office, and I had to learn about everything. And then as my training in internal medicine went on, I realized there's just a lot to learn. And I started thinking about my lifestyle. I wanted to have kids, I wanted to have a family. So I started looking at something that would have a slower pace. I wanted to have a flexible lifestyle because, like I said, I wanted to have a family. I loved the idea of critical thinking. I use my mind all the time. I don't ever have to touch a patient. As long as I can read their labs and ask them questions, I can do my job. And there are tons of jobs. So I was not worried about having to find a job. It was more of, what job did I want for myself? So then what is an endocrinologist? It is the coolest specialty ever. It's in high demand and it's only growing. Why? Our population is becoming more and more obese. Therefore, we're getting more and more diabetes. It is the study of hormones and metabolism. We are literally the body's chemistry manipulator. So anything chemical in your body, that's what an endocrinologist does. We take hormones that are too much and we take it away. And if you don't have enough, we give it back to you. So what does an endo do? We manage complex metabolic disorders, obesity, diabetes type 1 and 2, and everything in between, PCOS, prediabetes, obesity, hypoglycemia. We manage complex hormonal disorders such as thyroid, adrenal, gonadal disorder, pituitary disorders, pancreas, and cancers. But seriously, what does an endocrinologist do? We think a lot, okay? So you become pretty well versed at taking an awesome history, because you understand that if you ask questions in the appropriate fashion, you're going to figure out what's happening with that person. You really have to understand the physiology of the human body, because you have to know what is normal and what is normal when somebody is sick. So you have to take all those into context. And the most interesting thing to me is when the other specialists have no clue what's wrong with someone, they send them to you. So they're like, hey, I have no clue. Can you help me? Is this a hormone problem? So I love that. What's a typical day for a classic endocrinologist? And I put it that way because I am not a classic endo. I'll go through with you what I created for myself. Most endos have a full or a half day at clinic. And then if you have a half day at clinic, then you do hospital rounds where you see patients in the hospital and do consultations. We get a lot of calls from patients because hormones, as you can imagine, are affecting your day-to-day. So there's frequently questions that have to be addressed by patients. Unfortunately, a lot of our medications are expensive, so we have to do what's called prior authorizations, where you basically argue with insurance companies as to why they need to provide the care that you need and have deemed important for your patient. Most endos work 4 to 5 days a week. Some work 6 to 7 days per week. The ones that work for a hospital tend to work longer days and take call at the hospital. What's call? So literally, anytime there's an emergency or something that's deemed to be urgent for your specialty, that hospital will call you, okay? So in my field, it's someone's blood sugar either is higher than the nurse is comfortable with or lower than the nurse is comfortable with, they will call me. So yes, that means at 2 a.m. when I'm sleeping, they'll call. And sometimes that means they will call 6 to 7 times at night, yes. Or if somebody is in an adrenal crisis and they're in the intensive care unit, if they're in diabetic ketoacidosis and nobody knows how to manage that, they call me and because you know what you're doing. You understand how to put in really cool orders, manage drips from your home. You do that from your home. You don't need to go in. I never went in. So what are other limits for an endocrinologist? Honestly, there is no limit to what an endo can do. The majority of endocrinologists actually do not work taking care of patients. Most of us work in research and in clinical trials and with pharmaceutical companies in drug developments. We are also AKA side consultants for other docs. Like I said, they'll call you and say, some doctors make their entire practice is side consults, where you charge a fee for a primary care doctor to discuss with you their patients and you give them your recommendations, which is kind of cool, right? Weight loss, I do a lot of that in my practice because we understand the hormones and metabolism. Pick any hormone that you like, and that becomes your specialty, and you can title yourself the prolactinoma guru or the hypothyroid or the Hashimoto guru of the world. Basically, whatever you desire, that's what you can do. So my career thus far, I was a hospital employed endocrinologist twice. The first one, I took very little hospital call, and I created that practice's endocrinology department that they did not have one and the hospital didn't have one, but I created protocols for them so that everything endocrine could go basically without a hitch. Then the second round, I was also employed by a hospital, but I did half of my day was at a hospital and the other day was at a clinic. I was also a pharmaceutical consultant for some drugs that they're developing right now. And because I like to do things my own way, I was never happy having someone dictate how I wanted to live my life, what hours I worked, what days I worked, when I could take off. So I created my own practice. I created a telemedicine practice that focuses on disease prevention and wellness, along with general endocrine care. I also do coaching for my patients to help them understand how to navigate stress and do better, because stress basically causes most of the diseases that I manage. And my office is at home. It's literally, I have a room in my house that became my office. I can pick up my kids every day from school. I take them to the playground. I take them to do activities. Any days that they are off from school, I'm home with them. Why? Because it's my office and I do whatever I want to do, which is very nice. I also do something called concierge medicine, which is, I have a very small practice. I cap my practice at 250 patients. Patients pay me a monthly subscription in order to have access to my care. They text me between their visits if they have questions. I really get to know my patients. I spend an hour at each appointment with them. So any and every question they have, I go over it with them. I work 4 days a week, Monday through Thursday, 9 to 2 p.m. And sometimes it's a 3-day week and sometimes it's a 2-day week, depending on what I have going on in my family. And I love what I do. I really do. I finally found it. I was the nomad that was looking for the perfect job. The perfect job wasn't there. So I made it for myself. And that's what I want you guys to think about. Moving forward, create your path. It's a long path like we talked about, but make it be something that you love to do and you enjoy it, right? It doesn't have to be a painful 13 years. It could be a 13 years that you had a really awesome time doing this. Be creative. Think outside of the box. There are so many opportunities out there. Be inquisitive. Ask questions. Don't be afraid. What's the worst that can happen? Someone say, well, that's a silly question. You know, this and this would happen. Whatever. Be exposed. The more you're out there, the more you're going to understand what you like and don't like. And you're less likely to fall into a path where later on you decide, hey, you know what? I don't want to do that. I want to do something else. So not only find your own path, but make your own path, because you can get to where I am today by doing a variety of different things. It doesn't have to be one thing. So that was all. I hope that you guys took something from that. And I guess we're going to open up for questions. Let me stop my screen.
Yes, we have some questions. Thank you for the great presentation so far, Dr. Silva. So the first question that was asked in the chat was, how has your identity as a minority, as well as coming from another country, affected your approach to healthcare?
So a lot. It's affected my career in a lot of different ways, and actually being a female and being a mom has definitely impacted my career path. And I wish I could say in a positive fashion, but it wasn't. How do I say this nicely? The world is not kind to those that are not the most common out there, right? So even during the interview process for school, it was very obvious that sometimes questions were being asked in a certain way because there was a certain expectation of something different, right? And even in my jobs, my husband is a physician, and when he and I would have conversations about how my interactions were with my superiors, he would look at me and say, well, nobody would ever talk to me that way. And I didn't like that. I did not like that at all. So being a minority, being a female, and being a mom, you have to have a tough as hell skin. And you have to understand that you belong wherever you belong. And if it's something that you have to stand up for yourself, and you can stand up for yourself in a very polite fashion, but you do it, because there's not a certain type of person that belongs or deserves more than you. And if you worked your butt off to get there, you make sure that those people respect you. I hope that answers that question.
I hope so too. That was amazing. I'm a first-gen immigrant. I just had my mom growing up, so I could really feel the passion while you were speaking. So I really appreciate that. So I guess another question we have is, do you have or know anyone that has advice for students looking to go into psychiatry? Are shadowing other kinds of doctors still beneficial for this kind of specialty?
Yes. Here's why. So what you think you love about psychiatry may not be true, right? What if, let's say, play the what if game, you were to shadow, I don't know, an endocrinologist, and you're like, wow, that's super cool. I love what she does. Cool. Then you go and you shadow a psychiatrist and you're like, ooh, this is not what I thought this was going to be. Remember my experience. I was very honest with you guys. I ping-ponged around so many times that my family would laugh and they're like, are you really ever going to do this? Yeah, I'm going to do it. It's just, I don't know what at the end this is going to look like. And that was okay. Psychiatrists, I think it may be a bit of a challenge to shadow a psychiatrist because of the relationship they have to establish with that patient. Those patients are very vulnerable at that time, right? And they're giving you information that they're terrified to share even with their closest friends and family members. So do they really want someone that they don't know sitting in that room with them? However, there is a place where that happens a lot. It's called a hospital. There are hospitals that have hospital-based psychiatrists, and you will get to see the reality of what being a psych resident is, because you'll be in the hospital and you'll be hanging out with those psych patients. And then you let me know how that goes. I love psychiatrists. I'm so glad they're out there, but that was the most terrifying rotation ever, and I could not wait to get the heck out of there. And every time the psych ward would call me for a consult, I wanted to cry, and I would say, is there any way in the world I can just see this person not going in there? Sorry, not for me. But we do need psychiatrists, okay? But look for hospital-based psychiatrists. They allow people there because I saw them there. The office may be a little difficult.
Right. Yeah, it's an immense responsibility. So I feel that. So another question we had was actually my question. It was in regards to the question, why do you want to be a doctor? What are your thoughts and how do you respectfully differentiate the doc's role from a nurse practitioner, a PAs, and other roles in healthcare where there's a lot more overlap in responsibilities? And I'd like to stress respectfully differentiate.
Correct. Don't worry, I got you. So here's the thing, and this is where I actually wanted to have a conversation about this with you guys, but didn't know how to approach it. But thanks for asking the question, so now we can. The reality is the medical world has changed a lot, even from when I was in your shoes, right? When I was in your shoes, ARNPs, PAs were very limited. And it was already difficult to get into medical school. And then it was already really difficult to get into residency, and fellowship was super hard to get into. And then you wander out into the world where you're looking for a job. Thankfully for me, that was not the case because nobody wants to be an endo. So there were tons of jobs out there, okay? And thankfully for my husband, there were tons of jobs out there too. But I have plenty of friends of mine that have significantly struggled in getting a job because our place, and I will answer your question more directly, I promise you, our place in medicine is becoming very obscured by other specialties and other professionals that are kind of encroaching in our place. So here's the real answer, okay? Nobody is going to have as much knowledge as you will, right? Because you will go through 13, 14, 15 years of training, and it's hardcore training. You're going to be diving in there. You spend hours upon hours upon hours reading, studying, and living that in the hospital, seeing those patients, doing your rounds, doing the work. You literally become an expert in something. I have friends of mine that are ARNPs, and they even tell me, listen, respectfully to you, I will never know as much as you do. Okay. So ARNPs and PAs, they do have a place in our world. Okay. They're there to help us because there are so many patients that need my help that I don't have the capacity to see all of those people. So that is, in my mind, where an ARNP or a PA comes in. They come in as an extension to my care. And in my old practice, I had one, and how I utilized her was in a certain fashion. Somebody had become stable in my viewpoint. However, the primary still did not feel comfortable managing that patient. That is when my ARNP, and she was my eyes on the prize, right? She knew what to me was leaving the treatment plan and when my patient was still stable. And whenever there was a doubt, she would ask me. And just so you know, every single day there was a question. Okay. So there is a big difference. And don't ever let anybody tell you that there isn't a difference, because there is. Because even when the questions would arise, I'm like, man, you've been doing this for a long time. Come on now, we got to get on there. But you can't expect something of somebody that they didn't live through, right? 2 years is not the same as 13, and it will never be. That was respectful, I hope, right?
I think so. Yeah, I think
Okay.
you really hit the nail. So the next question we have is, as someone who focuses in wellness, how do you deal with the rise of people sharing wellness, weight loss advice on social media, who are unqualified and often spread misinformation?
So I find that as an opportunity. It's an opportunity to provide proper education. Unfortunately, sometimes the advice is to the detriment of the patient. And I've seen that quite a few times where people come to me that now have heart cardiomyopathy because they were taking certain things that they shouldn't have. Or I had a guy super young, his cholesterol was 6 times the normal because he decided to follow a keto diet and was putting butter in his coffee. So unfortunately, we cannot control what is out there anymore. We just can't do it. But we can do our job in providing proper education and guidance, which is why I'm not a fan of recording stuff for social media. I have a busy life and I love my free time. I'm not going to lie. I love my free time. Who the heck doesn't? I gave up my best years of my life to get here. So now I'm going to enjoy it. Okay. But I believe that I have a duty to the people that have no access to me to show them this is really what it's like. And which is why 2 Wednesdays a month now, I answer general questions that the public has. I mean, is that time consuming? Sure, whatever. But I'd rather them ask me than ask someone else and find questions where they shouldn't. So the wellness world is a challenge in medicine, but as everything else is, there are people out there giving advice about things that they should never give advice. So you stand up and you advocate and you create a panel for yourself and you teach people the right thing.
That's amazing. I just like to ask a follow-up question. So what if you're educating, right? I live in California. Anti-vaxxers are a thing here. So how do
Here
you?
too, don't worry.
All right. So I just want to know, like, how do you approach, patients who, despite giving the information, right, still want to go in a different direction?
So I'm going to answer your question with a question. How did you approach that patient? Right?
Right, that's valid.
So I really wish that every medical school did provide training on how to properly address and talk to patients. So I'm also getting certified in becoming a health coach. Why? Because I realized how important it is to understand how to ask questions that are difficult without making someone feel like they're being judged. However, they are being given the right to choose and the encouragement to make a good choice, right? So whenever I have patients, because I have plenty of patients that come to me and say, well, I'm not going to take that vaccine. Put yourself in their shoe for a second. Okay, so what's happening? Oftentimes this comes from fear, right? Because they heard or read something that to them was scary. And unfortunately, us as physicians, we are so darn busy doing our job that we are doing a terrible job at our job. And I say that in the way that we are not providing people with the sense of comfort where they can think to ask us things. We are not accessible. So instead of coming to the person that they should, right? Me, ask me. I trained in this. I wear this thing for a reason. They go to everybody else. So the first thing is, and I do this in my practice, right? Hey, so tell me what's going on. Why are you thinking that? Well, I heard from a friend that a cousin's uncle, sister's brother's neighbor had it and this happened. Okay, and do you know this person? No, I don't. Okay. So do you know what that disease does? Actually, I'm not so sure. Okay, so do you know why they created that vaccine? Actually, I really don't know. Can I tell you? Sure. Well, this disease is terrible because if you get it, X, Y, and Z can happen, and the rate of death is actually really high. Oh, do you know where the idea of no vaccines came from? Actually, I don't. Perfect. So can I tell you? Sure, look it up. That person actually lost their license because they were spreading misinformation. And then I tell them, also, I am a mom and I have 2 children and I choose to vaccinate my children. Why? Because I would rather my child get a painful arm and a sore arm for a day or two, a mild headache and a fever, but I know that they won't get something that later on I can regret and they'll have amputations, dialysis, or die. And I say to them, you don't have to decide today, but I'd like for you to read more and give them resources, right? And then you come back to me, you can ask any other questions.
Wow, I really love that. You're sort of spreading the onus and really helping patients take their health into their own hands. That's really awesome. So I guess another question is that pops up is, obviously you're a DO. Do you find that your training, I guess, maybe separates you or provides you a different perspective in your field?
So I actually do. So my primary care was a DO. And if you guys look at my social later, watch the video of why I chose to be a DO. I hated going to doctors. It was to the point that I would avoid going to doctors. I hated going to doctors. I would feel anxious and just didn't want to go. But I had a new primary care doctor. He was the DO, and the guy was so cool that I was driving home and I told my mom, like, I love him. He's so awesome. She goes, yeah, that's cool. And I thought to myself, well, I like science. Why don't I do this? But I'm scared. So I talked to him the next time I saw him and I said, Dr. Garcia, I love you. You're really cool. I had never met a doctor like you. I'm really thinking about becoming a doctor. And he looked at me and he said, if you like being a doctor and you want to be a doctor like me, you have to be a DO and you have to go to my school. And I was like, all right, cool. So the seed was implanted, right? Sadly, he moved away to a different place. But I think that, and I can only talk from my personal experience, right? I think that the difference between a DO and an MD is the following. From my training, we were always taught to take a seat back and take a look at what's happening from the patient side, right? And to look at the entire patient, because I hinted to it beforehand, stress and lifestyle causes 90% of the diseases I manage. So, and it took me getting sick for me to re-flash that into my mind and to realize, wait a minute, right? Like, there's so much more to this person than what's currently presenting. So I think the DO training allowed me to remember that. And it taught me how to look at the person, not only for their wrist pain, but overall what's happening to them. And the manipulations part is really awesome. I suffer from migraines and my husband is a DO like I am, and I'm having a headache. When he comes home, like, hey babe, can you do an adjustment for me? Sure. Awesome. Great. No Advil, no Aleve, no nothing. My headache's gone. I love it. Be a DO. It's best.
That's awesome. I could just imagine the two of you doctoring on each other. That's dope.
On the floor. Because we don't have a table. So
right. Yeah,
that's okay.
That's awesome. I love that. I love that story. And there's this, I guess, like maybe a misconception or assumption that
you can say it. Go ahead.
That DOs have a stigma. I just want to know, like, do you
There is
find
a
that
stigma?
Do you feel like it's more so maybe in healthcare or just students trying to enter the field, or do you feel like it's in the patients too? Do patients see you any different?
So it's everywhere. And unfortunately, a lovely comment directed at our former president's care kind of brought that to, but maybe it provided an outlet for education also. So, and this will change, right? So when I was applying for residency, there was this label that I could only apply for DO residencies. Was that true? No. But I was told, and I can't tell you if that was true or not, that we would not be looked at the same. And it was a fact that, let's say it was an MD school and they had 12 spots, they would leave only 1 to 2 for a DO, right? But with the merger happening, that's supposed to be less common. And I say but with a huge but on that one. My husband is a DO as well, and he did all of his training at an allopathic hospital, and he chose a path that's hard and it's not easy to get into. He was an anesthesiologist and then he did interventional pain, but he was kick-ass. His scores were the highest scores. There was no passing this kid by. Like if they passed him by, it was like, okay, that was dumb of us. So the label DO at that time didn't matter. But even when I became a practicing physician, I would go in to get my badges and they would automatically put MD. And I'm like, no, DO. Oh, it's the same thing. I'm like, no, it's not. Put DO. Change my label, please. I stand by what I chose to become. And I did have patients ask me, well, what are you anyway? Are you like a glorified chiropractor or something? And I was like, absolutely not. I love that comment. And I could, if you needed me to adjust your back. However, I am a physician and I trained hard. So there is a stigma, and hopefully the public eye now has become more aware that we are no less, we are different, but and we can be just as good, if not better, in certain ways.
I love that. Facts. We got a question about, like how you got into private practice. Was there a particular point in your career where you're like, yes, this is the time for me to open a practice? And then I guess what went into, setting down the groundwork financially and all those other things?
I love that question. Thank you, whoever asked that. So, not to scare anybody away, right? You work really hard and then you go to get a job and you're treated like crap. Because that's the reality. Most doctors are treated like we are disposable, replaceable. Why? Because there are plenty of people willing to take your job. So I bounced from one job to the other because I wanted to be treated with respect. And why did I go to school for 13 years to have someone give me a dirty look when I told them, hey, my kid has a fever, I have to stay home tomorrow, I won't be able to come in, let's reschedule my patients to this day, right? Why? And then to have my director make comments at me as to, was I going to choose to have more children because it's very disruptive to having a practice, right? So at one day I said, you know what, I'm tired with this. I did not give up my life. I did not kick butt and do all this work to have someone tell me that what I'm doing is not enough or how I have to do it. And I'm going to do it for myself. Why? Because my parents had their own business, and why can't I do my own business, right? So I told my husband, I said, hey, we had to put some money aside because I'm out. And he said, great, you're miserable as hell. I'm like, yeah, I am. I love what I do and I love interacting with my patients, but the drive to work would stress me out, and I hated Sundays because I knew Monday was coming. And I didn't see a difference. Every time I applied to every endocrinology position in my county, which was 5 of them, and when I started asking the right questions, remember I said, ask the right questions. What if this? What if that? What if that? I would get the, look, and I'm like, nope, that's not for me, right? So we saved up money, and because I think out of the box, said nobody likes to go to the hospital to see patients. There are all these hospitals that have no endocrinologist. That's what I'm going to do. So I called the CEO for every hospital and say, hey, how would you like to have an endocrinologist round at your hospital? Oh, yeah, that'd be great. Except for your application requires me to have someone cover me. I don't have that. That's fine. Fill out the application, send it in. I'll get it through. So I did that. And I was the only endocrinologist rounding at 3 hospitals. It sucked, right? Because you get called all the time. And I was covering for my old partners because guess what? They couldn't find anybody to cover my position. Haha, great. And then once I started getting busy enough, I said, you know what? I want to have my life and I don't want to work every weekend and I don't want to get called at night. I'm going to open my own office. And I started looking around. But office spaces are expensive. And I said, nope, I have an office in my house. I'm going to be a telemedicine doctor. And I did. So I created a website and I started advertising for myself. And I contacted all my friends that were primary care or other specialties. And I said, hey, I'm doing this. And no, I don't take insurance. Why? Because insurances in Florida are closed. So if you open your own practice, you can't get on insurances. But I offer an amazing opportunity for patients. They get an hour with me and I will do whatever it takes to get them healthy. So the patients started trickling in. My overhead is very small because I'm at my house. I have to pay my internet. I pay someone to answer my phones. I pay someone to manage my social media. There's expenses of being a doctor, malpractice, and all that nonsense. But this is why I said, you make it be what you want it to be. Whoever said you can't make your practice be whatever you want it to be? So you create your own practice.
That's awesome. I love that story of how tactical you were. That was really interesting.
Think out of the box.
Yeah, definitely. And I don't know if I'm presumptuous in assuming that that sort of mindset came from your immigrant parents.
Yes.
Shout out immigrant parents. That's dope. So
we had to be resourceful. Come on, whoever thinks to sleep in a closet because you can't stand sleeping next to your siblings.
Yeah, definitely. So a question, I guess a good follow-up would be, how has it been to be a telemedicine doctor during the pandemic? And like, what are, some of the things that maybe, we don't think about?
So at first, I thought it wasn't going to work because people were just like, oh, what the heck are you talking about? You're going to do this on video? But then Corona happened, and a positive thing was people were afraid to go to doctors' offices. So then they were like, oh, this is great. And I would tell them, listen, as an endocrinologist, I literally could be blind and be an amputee and paralyzed. I never have to touch you. You're going to miss nothing of this. Like literally have never, ever have to examine a patient. As long as they can describe to me their symptoms, I can review labs. That's all I need. So the challenges with telemedicine were that, right? Selling the idea that you would still have the same quality of care coming to me virtually versus in person. But thankfully, Corona changed that. The other challenge is when the pandemic happened, schools were closed. I have 2 small children. So they were home with me. And because I was still rounding at the hospital when they needed me, there was nobody willing to watch my children because they were afraid that I would come home with a virus and give it to them. So that was really fun. Seeing patients with my 2-year-old running around behind me was a challenge. But beyond that, I think the future is telemedicine. I have patients throughout the entire state of Florida. I see most of my patients in their pajamas. I have unfortunately seen my patients on the toilet, and I kindly ask them to not do that next time because that's not appropriate, as long as I'm not seeing their privates, and please don't wipe because we're in the middle of our visit. But I mean, it's great. So if you, whatever you're planning on doing, that's the idea, right? Think ahead of the game. So September 2019, I was already imagining telemedicine. So when things went crazy, March 2020, boom, I already had all my setup. People were calling me. They're like, how do you do this? I'm like, haha, it's easy. This is what I do. So plan ahead, be creative. People like it. And if you have bad internet, that's another thing.
Oh man, yeah, that's really interesting, and I'm glad your Munchkin gets to see you in action. That'll
Correct.
definitely leave an imprint for a long time. So yeah, just sort of bouncing off that idea. I guess how have you handled, working from home and having boundaries between professional and personal life? How have you, worked things out with your husband, who's also a doctor? Yeah, just curious to hear your thoughts.
So this is something that I would love for you guys to take from this. Boundaries are super important. And no matter what job or career path you take, you're going to have to learn how to set those boundaries for yourself, because there's always going to be somebody willing and wanting to push those boundaries. Unfortunately, when you're in training, you're there are boundaries, obviously, that are just beyond appropriate. However, your work hours and things that you're doing are beyond your control. But when you're in private practice, or even as an employee, you can create boundaries for yourself. So because my patients are concierge patients and they can literally text me at any time, and since we've been on, I have 3 messages from patients. That's on me. That's on me to say, you know what? Part of the reason I left an employed job was because I wanted to have it all. I wanted to be a mom and I wanted to be there for my children. And I also wanted to have quality time with my husband, but I also want to be the best at what I do with my patients. So when I'm on at work, I'm on at work 110%. My phone is off. I'm not paying attention to anything else because my patients deserve me 1000%. However, the minute the clock ends, that's it. It's my family time because my family also deserves me. They didn't choose for me to be in my career that I am in, right? My kids had no control over that. My husband is very understanding because his work is very chaotic as well. But you have to decide that for yourself. And as a doctor, it's very difficult because you feel like you owe something to your patient, right? And it took a good friend of mine saying, well, you know what? Is it going to kill that person that messaged you at 5:30 p.m. on a Saturday to wait till Monday at 9 a.m. to get an answer? And the reality is no, right? Because it's okay. And they have to understand that also. They have to understand that we are humans. And this is what is very difficult for people to understand. Your patients will not have an easy time understanding that you, beyond a doctor, are a person. And you will have days that you don't feel well. You have a personal life, you have a family life, you have things beyond your job that may take you away from them, and that's okay. And if they can't respect that, then they respectfully do not belong to you, and they belong to somebody else that's willing to give that up.
That was fantastic. You should really have your own YouTube channel, because I
Let's
definitely follow.
go.
Yeah, let's do it. Yeah,
Let's do it. You and I project.
that was some real talk. Yeah, I love that. And yeah, I recently like found this book. It's like Doctors Cry Too, where it's from like this doctor who was talking about, you know, like life beyond the hospital, you know, like, you know, there's kids' birthdays that are also important. So things like that. That was really awesome.
Let me just finish on something with that. What I want you to understand is the career that you think you're choosing, right? Because you haven't chose it yet, is a wonderful career in many ways. You get to experience the best days and the worst days for people. You have no idea what it's like to be there the moment someone's dying and to be giving your all to keep that person there. It's a lot, right? And it can and it will change who you are. I am not the same person I was when I was sitting bright-eyed in your seat. I'm not. I wish I could say that I was, but I'm not. And I have memories of things that I wish I had never seen because they changed me. But I also say that I was given that gift. Those people were willing to allow me to be there at that time. So what you have to understand is you're choosing something that will change you, and it will take a lot of your emotion. And there's a lot of depression in medicine because of that, because we live trauma all day long. But we are looked at as beyond humans because we're not allowed to have emotions. You can't be in that room with your patient and be breaking down because it's not your turn. It's their turn to do that. Okay? So understand that going into this, that you deserve every moment of you being you outside of your job because you damn well earned it. You give more than any person could ever imagine to people. So you deserve your moment too.
I have no words. Thank you so much for being so raw with us. That was, man, I feel like my soul has deepened and expanded. That was amazing.
And I hope that your career path will do that to you. Go through medicine, understanding the beauty of it, and that it is a gift. It really is a gift to be able to be there and to touch people's lives. It's not about the money. It's not about the beautiful badge you get to carry or the title that people give you. Because I hate to break it to you, the money isn't there anymore. The money is gone. You're not going to go into this and be a millionaire, but you can get something beyond any expectation. And you'll enjoy that journey and be kind to that. And when you see those patients, give them the respect that they deserve and be there for them. And I promise you, you will be the best doctor in the planet.
Thank you. Yeah. And I guess to just, you know, maybe transition from that. I don't know if I can do a good job.
That's okay.
Because you know, that is a real thing that you shared with us. You know, the gravity of this role, not just being a doctor, but just in any health field, I think, is the fact that you hold a person's life in the balance. It's such an intimate thing. There's a lot of weight on that on that shoulder of yours, and I can see it from here. Um, so a question that was asked was, do you feel like going into private practice, you can maybe dedicate a little bit more time to patients? And then I guess, can you talk about, what are maybe some barriers that folks might have in getting not just your services, but just private care that might be a higher quality, but just a little less accessible?
Sure. And I'd love for the public to understand this. Okay. So unfortunately, the person that decides the quality of your care isn't your doctor, it's your insurance company. Okay. Insurance companies have lowered their reimbursement rates every year, right? So in order to run a practice, it's a business. You have to have enough money to pay for all your staff and all the things that are required of you to be a doctor. And you deserve a salary as well, because you have student loans, you're going to have a lot of it. So when practices look at it, they look at the volume. How many patients do I need to see in a day so that we can be sustainable? How many hours we open, and that sets up for time slots. So most doctors are blocking off patients for 15 minutes. That was part of my job that I hated, because I know that my patients needed more than that, because as we talked about, as an endocrinologist, I have to get to the bottom of what's happening, and it's not superficial. If I get in deep, I know what's really happening and I can give you the best answer. But in 15 minutes, I can't do that. So part of the reason I chose, and I was grateful that the insurances all closed the door and said, no, we're not taking you, was I can make my appointments be as long as I choose, right? So I block my new patients off for an hour. And most people are like, that's crazy. But at the end of that visit, 99.9% of them are very thankful, because they got to ask every question they had. They had their history fully taken like it should be, and their labs explained to them in a proper fashion, so that they're not relying on Google or other specialties and other fields to do that. So what is the limitation? There's two limitations. One is having even the patient understand that in order for them to get quality care, they may have to invest beyond what they already invested in their insurance premium, because in their mind, I already pay for a premium. Why should I also pay for a doctor's visit? Right? So there's a disconnect, but they don't understand that the insurance doesn't have their best care in mind, right? And there has to be something. And then the accessibility, right? So I can't see how many patients could I possibly see if I'm blocking off for an hour.
Right. That's yeah, it's a difficult dilemma to be in, but I'm glad that you're figuring things out, and doing your job to the best of your abilities. So we're reaching sort of the end here, of our call, and thank you so much for being here. Do you have any last minute advice for the folks on this call going forward?
I do. So first, I want to say thank you. Thank you for bringing me on here. And I'm really happy that you guys have something like this. It's wonderful. The takeaway point from this is don't be afraid. Don't be afraid of anybody out there telling you that whatever way you chose to get to the end, it isn't the right way, because they don't know what they're talking about. Nobody has decided that for you. If you really believe and want this, you will get there, and you can. Don't be afraid to reach out, phone a friend, get advice, get proper advice. And the most important thing is, don't be afraid to make this be what you want it to be, right? Because at the end of the day, this is going to be the rest of your life. So make it be something that you can enjoy every day and that you can be proud of, so that when you look at the clock, you're like, wow, the day has ended. That was a great day. You're not looking at the clock to say, hey, I'm ready to go. I can't wait to get out of here.
Wonderful. Thank you so much again for joining us, Dr.
Oh, you're welcome.
It's a pleasure. We do have one question in the chat that says, is there any way to reach you via social media?
Sure. I'm on Instagram. I'm at Endocrine Help. Whatever question you guys have, toss it in there. You guys can fill up my 2 Wednesdays with all the million questions I'm sure you all have. I don't care, I'll address them.
Wonderful. Thank you so much. We are going to go into our little wrap-up presentation. So for all of our students who are joining us today, you guys actually can get a certificate that verifies your virtual shadowing hours for joining us during this virtual shadowing session. We are going to first, before we begin, announce the winner of our mentorship networking event raffle. So congratulations to Andrew V. You are the winner of today's raffle. You will be receiving an RSVP link to our mentorship networking event on February 19 to 21. If you are interested in joining us for this event and you did not win the raffle today, no worries. We'll be having one all next week to join us in the raffle. We'll also be doing some giveaways on our social media, so be sure to be following us at Pre-Health Shadowing. All right, now just some time to reflect. We just had an amazing presentation. Couple questions for you. What brought you to the session today? What are your 3 major takeaways that you got from today's presentation? And what do you want to learn more about? Of course, you guys do not have to send this into pre-health shadowing, but if you are looking to get any type of recognition, get this posted on our official pre-health shadowing website, you can submit your work to prehealthshadowing.com/blog submissions. We are taking pieces of writing from students, writing articles, reflections from virtual shadowing sessions, reviews, or success stories. You guys can submit this on our website and for the potential opportunity to be posted and featured on the official pre-health shadowing website. You can put this information on your resume, your CV, your application, your LinkedIn, wherever your heart desires. Next slide, please. If you are interested in being a part of pre-health shadowing, we are a student-based, student-led organization. You can become a student volunteer 100% remote. We do have both synchronous and asynchronous opportunities depending on what you want. If you guys are interested in gaining a leadership role and getting some experience with students all across the world that are interested in going into healthcare and making an impact on the world, you guys can apply to be a part of our student team. prehealthshadowing.com. Again, we are completely relying on the support from our community to continue pre-health shadowing and make it accessible as we fight inequity in health education and promote diversity in the various healthcare fields. We do ask that if you guys are financially able at this time to please donate. We understand that this may not be accessible for everyone, so if you are financially unable to donate at this time, we encourage you to send this out to any family members, professors, family friends who will be interested in supporting your education, so we can keep this free for everybody. Thank you all. Alrighty, and here is the part where we get our certificates. So you're gonna go to our website, prehealthshadowing.com. You're gonna find Dr. Anna Silva's profile on the homepage, and you're gonna get 30 minutes and 2 tries to take a 10-question post-shadowing assessment, and you will have to pass it with a 70% or higher in order to get your certificate. You will be able to download your certificate immediately after passing the post-shadowing assessment and clicking Finish Course. All of our post-shadowing assessments are open indefinitely until further notice. So if you're unable to take it right after the session, no worries. We'll actually be posting the recording of today's session on our website and our YouTube channel for later review. You can follow us on our social media at Pre-Health Shadowing and subscribe to us on YouTube to watch any of the previous virtual shadowing sessions for free. Be sure to catch our daily weekday live sessions. We're having one every single day. We are booked all the way up until June. You can register in advance on our website, prehealthshadowing.com. You can also sync pre-health shadowing to your Google Calendar and have it automatically translate into your time zone. This is amazing if you guys aren't in the Pacific Standard Time, in which the headquarters of pre-health shadowing is based in, and you will always have it directly inputted into your calendar with all of the Zoom information. Thank you all so much for joining us. We hope to see you next week at our next virtual shadowing sessions. Feel free if you have any questions. Members of our student team will be sticking around to answer any questions you have or to just talk to you guys. Thank you again for joining. This is the end of today's virtual shadowing session, and I invite you to disconnect from the call. Have a wonderful weekend, everybody.
Thank you so much.
Thank you.
Thanks, guys. Bye.